Good afternoon, everybody. It's been ages since I've actually seen all of you. So as a brief reminder, I'm Nicole Fowler. I sit in the IU Center for Aging Research, and I have the pleasure of introducing our Stand Talk speaker today, Dr. Wendy Rogers. And if you were on a few seconds ago, you might have heard that Dr. Rogers was actually scheduled to be in person with us last spring, and we had to cancel, and we were lucky enough to reboot our Stand Talk to be virtual, and we're able to get her back on the calendar for today in our new format, so we're really pleased. Dr. Rogers, she's actually stationed just a little bit to the west of us. She is the Shahid and Ann Carlson Kahn Professor of Applied Health Sciences at the University of Illinois, Urbana-Champaign. Her primary appointment is in the Department of Kinesiology and Community Health. She has an appointment also in educational psychology and is an affiliate of the Beckman Institute, which is at the Illinois Informatics Institute, the Center for Social and Behavioral Sciences, and the Discovery Partners Institute. So you'll see a lot of overlap with the things that Dr. Rogers is interested in, and those of us in not just IU-CAR, but also in informatics and HR. Her research interests include design for aging, technology acceptance, human automation interaction, aging in place, human-robot interaction, so not quite cloning, but robot interaction, and then also aging with disabilities, cognitive aging, skill acquisition and training. She's also the director of the McKinney Family Life Home, the director of the Health Technology Education Program, and the program director of CHART, which is the Collaborations in Health, Aging, Research and Technology, and the director of the Human Factors and Aging Laboratory. So we are really in for a treat today to hear Dr. Rogers and her talk about technology for aging. So join me in sort of virtually welcoming Dr. Rogers. I will pass it over for you to share your screen.
Excellent. Okay, thank you so much. Let me get set up. There we go. Are we seeing my main title slide? Great. Thank you, Nicole. What a wonderful introduction. I'm really excited to be with you virtually. And what I decided to do is to give big picture of different things that I'm working on, because one of the things, Rich Hold and I have talked about, I still want to come visit. There's a lot of opportunities for collaboration. And so I want people to be aware of all the different things that we're doing here and think about how we might collaborate. So I'm not going deep on anything, I'm going broad, but I know I'm meeting with some folks after, and I welcome any questions as we go along. First, I like to always introduce our slide template here. So this is the slide template for my lab, and all of the people pictured here are family members of our lab members. So we have a multicultural lab, and so we have a multicultural set of family members in our pictures. Nicole gave a great overview of the various things that I do. Like many academics, I wear a lot of different hats, and I'm going to tell you about a few different things, mostly the center, the program, the CHART program, what we're all about, and then research in my lab, the Human Factors and Aging Lab. And then I want to take you on a virtual tour of the McKinney Family Life Home, which is just opened in January. We're very excited about that. And then very briefly, I'll tell you about the new education program that we've just started. You already know this. I just like to start with this slide about the aging population. And I like this graphic that comes out of the World Health Organization because it shows the increasing number of people over the age of 60. So WHO counts older adults as over the age of 60. In our work, it's often over the age of 65. But what you see is if you look at the dark blue, that's areas of the world where more than 30% of the population are going to be over the age of 60 by the year 2050. I had one of my students do this for the state of Illinois. So I recommend you do this for your state as well, because it's quite informative. So he was able to grab the data from the Illinois Department on Aging and do the same thing and look at, well, what's happening in our state? And the county outlined in red here is Champaign County, where the university is. And you can see that there are going to be areas of our state where over 40% of the population will be over the age of 60. And I was really inspired by this report. And if you haven't looked at it yet, I really encourage you to do so. It was put out by the World Health Organization, and it is the World Report on Aging and Health. And it was released in 2015. And I was invited to go to an event that was related to the release of the report. And it really changed my way of thinking to start thinking more about translation, and you'll see that as a theme in what I talk about today. One of the key points of this report is to think about, if you look at the far end, the goal is maximizing functional ability. And we think about healthy aging as an investment in health systems, lifelong learning, social protections that will yield benefits for the individual health, skills, mobility, connectivity, and so on, but then also return for society at a broader level in terms of workforce participation, social contributions, and so on. The other thing that this report does is to help us think about what are priority areas for action. So we need to think about how are we measuring, monitoring, and understanding where we are now. How do we align health systems to the older populations that they currently serve? And also think about long-term care systems with the goal of ensuring everyone can grow old in an age-friendly environment. And the World Health Organization has designated this as the decade of healthy aging. And so we're starting to see more and more attention paid to the needs of older adults around the world. And that really was one of the sparks for me moving to the University of Illinois. So I moved here in 2017. I spent 18 years at Georgia Tech, moved here in 2017 to start this program called CHART, which is Collaborations in Health, Aging, Research, and Technology. And this is within the College of Applied Health Sciences, but it is collaborative with faculty across colleges, as well as with the community, industry partners, healthcare providers, and our common goal is promote aging successfully through technology. I also wanted to comment, I think this is being recorded, but I'm also happy to share my slides later because I have links to various things throughout. So the mission of CHART is to think about all facets of what we need to do to support successful aging. So there's obviously research, but also technology development, education broadly defined, educating researchers, developers, healthcare professionals, the older adults themselves, thinking about how we can influence policy, decision-making, and translation of these efforts. So as I mentioned, I was in a psychology department and, I was able to think about translation, but I wasn't able to do translation. Now I'm in the College of Applied Health Sciences, and that is our mission. And that's one of the missions of CHART. So we thought a lot about what our core values are and how do we go about achieving this. We want to be transformative. We want to think about positive views about aging. A lot of what we see is really negative, that growing old is a bad thing. It's not a bad thing. There may be challenges associated with it, but we should have a much more positive view. We want to make sure we're including older adults in our design, thinking about issues of equity, affordability, working with older adults. And then, as I mentioned, trying to integrate our findings with industry, agencies, and policymakers, be international in our scope and interdisciplinary by design. So we work at the intersection of 4 different domains. So human factors, healthcare, technology, and aging. And within the CHART center, there are a number of different labs that are affiliated with our center. These are all directed by different faculty members. My lab is the Human Factors in Aging Laboratory, which is what I will focus on. And the goal here is to think about what are the abilities, limitations, needs, preferences of older adults, work with them to develop usable and useful products. Think about training and instruction, which is often left behind when we're designing new things, and it's critical for success. And that will lead to better deployment and introduction of these technologies. So this theme of supporting successful aging, which we define very broadly. So when we think about what older adults have to do, there are basic activities of daily living. You're probably aware of this category of activities: fundamentals, bathing, eating, drinking, mobility. Next level up, instrumental activities of daily living, managing the home, managing your health, more tend to have a little more cognitive component. When I first started in this area back in the mid 90s, this was the primary focus. Okay, this is what we need to support for older adults. But we did a focus group interview study with older adults, and we found that they do a lot of other things, right, that we should be supporting. And so we coined this term called enhanced activities of daily living, which is all the other things: social communication, hobbies, new learning, continuing to work or volunteer, participating in your communities. And just a brief shout out, these are all pictures of my parents. I like to have them in my presentations because seeing their smiling faces makes me smile. So our lab, Human Factors and Aging Lab, is affiliated with 3 different centers. And I mentioned we're always very interested in collaborations. One is the CREATE Center, which was founded in 1999. We've been continuously funded by the National Institute on Aging. We're under review right now for CREATE 5. And in this center, we focus on designing for all older adults. What are our needs going to be as we grow older, and how might technology support those needs? Oops. In 2013, we started a new center that's called TexAge, and this center is focused on technologies to support aging in place for people with long-term disabilities. And this is funded by an organization called NIDLR, which is Disability Independent Living and Rehab. And here we're focused on people who have mobility impairments or perceptual impairments, and they're getting older. Right? So they might have dealt with these challenges their whole life, but now they're also an older adult and they have added challenges. And then just very recently in 2019, we started a 3rd center called Enhance, which focuses more on cognitive issues. And so the focus of Enhance, also funded by NIDLR, is older adults who are aging with cognitive impairment, either due to a traumatic brain injury, perhaps a stroke, or they have mild cognitive impairment. So these are the main supporters of the different research projects that I do. I wanted to introduce the CREATE framework for technology design because this, I think, encapsulates how we approach everything. We think of the older adult as being at the center, right? You need to understand the older adult's needs and characteristics. You need to think about what the technology is that you're imposing on them. What are the demands of that technology in terms of hardware, software? What kind of support are you providing? What kinds of tasks are they trying to carry out? How complex are they? Do they require collaboration? All of these activities take place in a sociocultural environment as well as a physical environment. So if we think about all these activity domains, any new project that we're starting, we try to think of this whole big picture and all of the things that we need to consider. We need to recognize the fact that there's no typical older person. There are really large differences in terms of the health of older individuals. There are ethnicity and race and experience, culture differences, education, income, so on. I won't go through the whole list. The main point is what's at the bottom is you can't think of people over age 65 as one general group, right? They're very different. But at the same time, there are certain things that will change for a lot of people as they get older. We do have more health challenges. Mobility, vision, and hearing tend to change as we grow older. Cognition changes, opportunities for social interaction may change, and consequently, the needs for support change as we grow older. One thing I want to highlight, though, is, sometimes there's a misconception that the majority of older adults are going to develop dementia. And I think while dementia is a serious issue that we need to be paying attention to, we need to remember that the vast majority of people under age 79 are not going to have dementia. So it's fewer than 10%. And even when we get to the age 80 to 84, it's less than 20% of the population. So we don't want to think that all older adults are going to be experiencing some serious level of cognitive decline. There may be cognitive aging changes, but not to the level of severity. It's only when we get out to above 85 or 90 that we're starting to see more and more of a percentage. We also need to think about technology experience. So my colleague Neil Charnas is awesome. I sent him a note last night saying, do you have the updated graph about internet use? And of course, he sent it to me at 10 o'clock last night. And because I was curious, my graph only went to this point, it went to 2018. And I was curious in the last couple of years how much it has changed. And what you see is there still remains a digital divide. So this is the percentage of people using the internet, and young people nearly 100%, right? Even the starting into middle-aged, you're getting well above 80%. But even today, these data, he said, go through 2019, over age 65, only 70% are even using the internet. So we need to keep that in mind when we're designing technology. They also tend to want assistance. So one of my themes in my own research is really remembering the importance of instructions. And so in the Pew data set, they asked people to respond to this question. When I get a new electronic device, I usually need someone else to set it up or show me how to use it. And they said, how well does this describe you? Do you agree with this or not? And for the younger adults, even for the younger adults, 18% of them said, yeah, that's me. I need some help learning how to use new technologies. For the 30 to 49, it goes up to 36%. Then when you get to the middle-aged and older adults, the majority of people want some assistance. So even if you've designed this wonderful new technology, if you're not providing them the support, the facilitating conditions to use it, it's not going to help them. My colleague Wally Boot and one of his students developed a way to measure what kind of mobile proficiency people have for using mobile devices. So this is a very useful questionnaire to get a sense of what type of proficiency an individual has that might guide the amount of instruction they would need to use your new technology. And so if we look at the younger adults over here on the left, they're all pretty clustered up here. They're pretty proficient on using mobile devices. And on the older adult side, you do have a group of older adults who are as proficient or even more proficient than some of the younger adults are. But the thing that's striking about these data, each of these points as an individual, is if you look at within this one age band, you have this huge range in terms of mobile device proficiency. These are the people who are going to be trying to use the technology that you're developing. And so there are a number of barriers to technology adoption that we need to pay attention to. So there's lack even of knowledge or awareness that the technology is out there. I've emphasized the lack of training and technical support. We cannot forget about cost, which is a real issue. System complexity and feature creep. So people might be using a technology and then tomorrow it changes, and that's very frustrating. And that the continual changes in technology and just general usability issues. I'm, continue to be surprised at how challenging some technologies are to use, even though they're potentially very, very useful. And in fact, that's our experience, that if the older adults think that that technology is useful to them, they're willing to invest the time to learn it. But making it clear how it would be useful to them is a challenge. So what I want to do is just give an overview of some different research projects that we're working on. I'm going to briefly review 3 different categories, 3 different projects. one looking at digital therapeutic, one looking at video chat, and then several different projects that are looking at robots. So starting with digital therapeutics, we have a project exploring how to improve hypertension medication adherence for older adults. And what's exciting about this project, it's funded by the National Institute of Nursing Research, and it builds off of my colleague Kathy Insell's early work. She's a Ph.D. nurse at the University of Arizona, and she had developed an intervention that worked great, but as soon as you took the nurses out of the equation, it lost its efficacy. And so she came to me and said, how can we use technology to help augment what the nurse was doing? And so Jeannie Lee is a pharmacist at the University of Arizona, and we have an RO1 project to focus on this system we call MedsREM, which is medication education, decision support, reminding, and monitoring. So it's a medication management system that we're designing to be a coach. And we're incorporating optical image capture of medications. We provide medication-specific education. One of the key things that Jeannie has done, Jeannie Lee, is to develop a formulary that provides decision support in real time. If you miss a dose, how much time has passed? What is the medication? What is the half-life? Should I take it or should I wait for my next dose? Often a decision that patients struggle with. It includes a personalized reminder schedule. It links with blood pressure readings, and we're developing visualizations of adherence and blood pressure over time. And it has both a mobile application and a web portal. And here's just a couple of images. These are not the final images, but it's an app that gives you reminder information about your medication. And then there's a calendar and some visualizations that will help you track your progress. So we're in the process of finalizing and testing the system, and then we're going to be doing a randomized controlled trial where we enroll nearly 450 people and we follow them for 4 weeks, and only the ones who are non-adherent will get enrolled in our trial. Like if you're doing a fine job taking your medication, you don't need our system, right? If you're not adherent, then you'll get randomized either to the MedsREM system or to an education control, and we'll be tracking them over the course of 6 months. And I think these kinds of RCTs are not done often enough in the context of technologies that might help improve adherence. So we'll be measuring not only adherence over time, blood pressure pre and post, but actual use of the app and who uses the app and what are challenges in using the app. Do they continue to use it over time? So this will be going into the field probably in January. So we're working on finalizing the system right now. The next project I just want to briefly talk about relates to social engagement. We know this is an issue. We've learned even more about how big of an issue it is in the last year or so. This report was put out by the Health Resources and Services Administration, and this was before, pre-pandemic, the loneliness epidemic that they talked about, that nearly 1 out of 3 older adults lives alone. That doesn't necessarily mean they're lonely, but it might be more likely to be lonely if they're living alone. And when asked, 43% of older adults reported feeling lonely on a regular basis. And their suggestion that 45% increased risk of mortality for those people who report feeling lonely. And we saw this in the news a lot when this report first came out. I really don't know what the evidence base is for this, but it's a striking phrase, right? That loneliness is more dangerous than smoking 15 cigarettes a day. And so, that's quite compelling. A couple of years ago, my postdoc and one of my graduate students and I did a review of social engagement, and I was really a little bit surprised by some of the findings that we identified, that higher levels of social engagement for older adults are associated with a number of things: reduced hypertension, decreased development of dementia, increased mental health and psychological well-being, and this was the one that surprised me the most, reduced mortality rates. And so, the importance of social engagement is can't really be overstated, I don't think. And as we've seen in the last year or so. So we partnered with a company called OneClick.chat, and their system, it's a video chat platform, but much simpler to use than other existing platforms. And it can enable meetings with family and friends, but what's unique about it is you can also use it to host events and connect people in conversations with other people who share their interests. They might not already know them, they might not be part of their family, but they share interests. And so it gives opportunities for social interaction and new learning and just getting the opportunity to talk about shared interests, which maybe you don't share with your family members, right? Maybe you want to branch out and meet more people. So this is what it looks like. And we call it the age optimized version, but again, this is not the final version. The other thing, though, that I just want to highlight is the opportunity to host events. And that's a lot of what we're exploring. I'll tell you a little bit more about that. So the phase 1 results are published. This is an open access publication in Geron Technology that talks a lot about all of the human factors approaches that we did. We did heuristic evaluation, cognitive walkthroughs, usability testing for this type of a system. And now we're very fortunate to have received the phase 2 grant, where we're looking at efficacy assessment. So we're exploring whether this actually does improve quality of life for older adults with and without mild cognitive impairment. And so there are 2 large aims of our phase 2. In aim 1A is where we are right now, is finalizing the one-click platform, developing content for these different events. So the way we have it structured is you might see a series of pictures around a particular topic, and then we give a set of discussion questions to guide the discussion for older adults with and without cognitive impairment. So they'll be in breakout groups, they can have some discussion, and then give us some feedback after the fact. And then we'll be doing another randomized controlled trial to assess the efficacy of this over a shorter time. You know, we'll have 6 weeks and 12-week assessments, and we'll be measuring social engagement, quality of life, and then user acceptance. The second aim is about scaling this, okay? So this is showing at the individual level, does it work? The second aim is looking at, for organizations, how might they use this tool? So we'll be working with home and community-based organizations. We have 3 different partners, and we're developing content that might be specific for their organization and making a dashboard for them that's easy to set up events, easy for their staff. As you probably know, there's a high staff turnover. You impose this technology on them, it's difficult to use, they're not going to use it. So it will be easy to use, and we will provide support for them for setting it up. And so then in aim 2B, we'll be actually testing it out with a different home and community-based organization. So we're in the aim 1A and aim 2A part right now, finalizing things, and then interviewing HCBO staff to find out how might they want to use it, what kind of features would be helpful to them. So before I talk about the robot projects, they're all happening in the McKechnie Family Life Home. I want to show you the McKechnie Family Life Home. When I moved here, part of the startup package was to build this kind of research facility. So at Georgia Tech, we have something called the Aware Home, which was the first generation smart home on campus. And so we were going to build something here at the University of Illinois, and we were very fortunate to get a donation from the McKechnie family, which allowed us to make it bigger than we had even planned. And so the LIFE is an acronym. Living in interactive future environments. And this is the basic floor plan of the Life Home. And I'll take you on a little tour of some pictures, but I wanted to show you that the orange part at the top is the home simulation space, We have an observation and control center that allows you to observe what's going on. We also have cameras throughout. I'll show you that in a moment. But then we also have all of this peripheral support space. We have a large development lab, we have conference space, and then we have a couple of remote research spaces. You might be participating in a study in the home simulation area. You can come through this door here and then participate in an interview. Or perhaps I'm trying to simulate a telehealth situation. I could be controlling it in the remote access lab, but the technology is actually being implemented in the home simulation space. So let me just show you, I'll just go through briefly just to show you what it looks like. It's meant to simulate a standard 2-bedroom home. It's not the home of the future. It's the home of today. How do we bring technology into that home to support the people who live there? That said, though, it's outfitted with smart appliances, smart technologies, and so on. We have 2 bedrooms. One bedroom is set up as a standard bedroom. The second one we've set up as an office space. One of the key things we focused on was flexibility. So it's very easy to move all of this furniture out and set up one of these bedrooms as an exercise room or as a kid's playroom or as whatever it is that you need for the research project that you're focused on. I mentioned the observation and control center. It has a one-way mirror, as you can see, that's looking into the living space. And then in a sense behind me here, it also looks into one of the bedrooms. One of the reasons for including this is it's very powerful for designers to see their products in action and to see people trying to use them. You know, they might think they've developed them to be easy to use, and then they discover that when somebody tries to use it, they have difficulties that they never could have imagined. So the live observation is very valuable, but then also we have cameras throughout the home. So this shows the cameras and microphones all throughout the home simulation area, as well as in the lab, the interview room, and the remote access lab. So we can also gather the interactions and analyze them later, you know, doing more detailed assessment of the activities. We also have what we've labeled the personal care research lab, which is a combination of the laundry room and the bathroom. The bathroom is deliberately large so that we can explore having a care provider in that space and looking at maybe robot support in the space of the bathroom. There was a cost to that, and it ended up resulting in the laundry room being very small. So the laundry room is not at all accessible. Well, that's true in a lot of people's homes. How do we deal with that? How do we design technology that will make it accessible to somebody living there? We also have the collaborative spaces. The meeting space here, it looks like it's one large table, but it's actually 4 small tables that can be customized for your meetings. And then this glass wall over here on the right opens out, so we have a larger space for community events. The remote access lab I mentioned, again, very simple, minimal furniture, but the idea is to set it up that allows us to simulate that anything, telehealth, telerobotics, telepresence, and so on. The interview room was also named. And so this is a space that allows for qualitative research, mixed methods, post-interaction interviews, and so on. And then this is the Health Technology Innovation Lab, which allows us to do development, you know, so we can host hackathons, design competitions. We're having classes in there right now for the health technology program. So it's just a nice flexible space. And then we have the the Transport and Transitions Lab, otherwise known as a garage, but I could not tell the architects that it was a garage because it wouldn't have been outfitted with the technology and the heating and the air conditioning that we needed in that space. So this is currently undeveloped, thinking of maybe getting a driving simulator, maybe exploring virtual reality applications. It's an additional space that we can fit to meet the needs of particular research projects. And that's what I want to tell you about right now, what's going on in the home. We opened in January. We've not been able to have research participants there. And so we've been focusing on the technology side of robot design so far. We have 3 different projects I'll tell you briefly about. One is with my colleague in Girish Krishnan in the Granger College of Engineering, and we're partnering also with OSF Healthcare. And the idea is to think about how might you use this type of soft robot, I'll explain that in a moment, how might you use this to support telehealth applications? So we have an internal grant funded to support this pilot research that we're doing. So the idea behind these robots is you might have look over here on the left picture, you might have a hard, rigid arm and then have a soft arm that comes out that enables you to do things like illustrated in the center here, to move up into a high area, but then with a soft arm, you're not going to be knocking things down. You're less likely to break anything, but also you're not as likely to injure a person. So it's specifically designed for co-located humans and robots. So this grant, we're looking at, what if there's a camera on the end of this arm? How might that be useful for healthcare providers conducting telehealth visits? And we're interviewing healthcare providers from their side. How might it be useful? We're interviewing patients. What would you think about having this robot in your home? And some of the example use cases that we've been learning about is wound care, or not wound care, but wound tracking. So after somebody's been released, it's very important from the hospital, it's very important to track how is their wound progressing. And you might have to send somebody out into a rural area for a 5-minute visit just to look, how are things looking? Whereas if you had a camera, that might be easy to use and easy to position in a location that current telehealth systems don't work. I mean, usually they're just in a spot, right? Whereas this could go and look at your back, it could look at your foot, it can look at different areas and can be set up to take the exact same picture over time. And then the healthcare provider can look at the progression. So that's just one use case. I think there's a lot of potential for this kind of technology. The second example is with a different colleague in engineering, Katie Driggs Campbell, and we're looking at wayfinding assistance for persons with visual impairment. So indoor navigation for people who are blind or low vision, and we'll be testing it in the life home context. So there are some products being developed, some robot support products. A lot of them are for navigation through crowds or in public spaces. We're going to be focusing more on internal spaces. So when you're visiting someone's home, visitability is a big challenge for individuals with disabilities. I can't go to somebody else's home and be able to navigate easily. Or going to a hotel, or going to a new dorm. So we're going to be testing this out with younger adults on campus who are blind, as well as older adults from the community. So right now we're working with the engineering team to develop the technology, and our team is focused on interviewing the older adults and the younger adults who have vision impairments. What are their navigation challenges in indoor environments, and how might we design technology, robots in particular, to support those needs? The third category that I want to describe briefly is with a company called Hello Robot, and they have developed a robot called Stretch. And our focus here is on supporting home activities for older adults with mobility limitations. And Charlie Kemp and I were at Georgia Tech together, and we worked with a very large, very heavy, very expensive robot. And it had a lot of potential, but it was just not going to be something that could easily be put into people's homes. And that's what the goal is here. This robot has a low mass, it has a contact sensitive body, so it can be used for human interactions, relatively small, relatively low weight. And so they've designed a what they call a research edition that is being used in various places around the country to test out what's the potential of this particular robot. Let me just show you briefly. This is my colleague Harshal Mahajan is controlling it using a remote control, and I'll show you a little bit more about that in just a moment. But the idea is to have this robot ready. We took it out of the box, and within minutes, we're able to use it. And Harshal is delivering, there I am in my COVID outfit, delivering the bottle of water to me. So we've submitted a grant for a small business innovative research to NIA, and we're focused on using Stretch to support home tasks. So delivery, so home tasks for older adults with mobility disabilities. So delivering items, turning on a light switch, for example, reaching to areas that are difficult for the person to reach to, opening cabinets. Part of what we're exploring is what kind of end effectors, what kind of things need to be on the end of the robot arm, depending on what kind of task we're being asked to do. So this opening of the cabinet actually turned out to be rather difficult with the current end effector. And so we actually have a mechanical engineering undergraduate student who redesigned a hook, printed it on a 3D printer, and we're testing out whether that makes it easier to open cabinet doors. So it's just a great opportunity for students to get involved in this project. The other thing that I think is really critical is controlling it. So on the left, this is me trying to control it using a game controller. That's how it's currently controlled. I am not a gamer. I do not know how to use this game controller. It's very difficult for me. So imagine this robot were in my home. Somebody else might be able to control the robot to get it to do what it needs to do. And that's what's being illustrated in the video on the right. So what you see is here's the robot in the life home. And then this is what the person who's remote sees while they're controlling the robot. There's a camera on the top of the Stretch robot, and this is the view that they have. And so we're testing out, can it pick up things? Can it do what it needs to do? And it's really quite effective. And this is just a research version. I mean, this isn't even fully fleshed out to be used for a broad range of people. That's part of the point of us doing this research. So lots of potential for this kind of robot to support individuals in their home environment, either controlling it themselves or with somebody else controlling it remotely. We're partnering with a fellow named Henry Evans who had a brainstem stroke. He's quadriplegic, and he's able to control it using eye gaze. And so he's part of our research team to explore the potential benefits of this kind of technology. So the Life Home has a lot of potential. You can see in action, some of the different ways that we're using it. We have a lot of different spaces. These are students in our health technology education program who are having their in-person classes in the Life Home this semester. And I just wanted to say that there's opportunities for collaboration. That's one of my main points, that folks outside of the University of Illinois can use this space either through partnering with us for grants or gifts or supporting students working together. So it's a wonderful resource, and we're not that far away from you. So I wanted you all to be aware of this. And then the last thing, I want to make sure I'm saving time for questions. I just want to mention our new master's program. It's a 1-year intensive. It's a professional degree in health technology, and the students do 36 credit hours. They have a targeted capstone experience. We started our first year during the middle of the pandemic, which was crazy, but we're making it work. Students are getting in-person experiences on campus, and we're recruiting for next year's class, and people can still apply up until May 1st. So it's a really exciting program. There is not another one like it that's really focused on health technology. There are programs that focus more on medical technology. We're focusing on health technology that might be used by consumers as well as healthcare providers. So there's my team. Earlier this week at our lab meeting, we're continuing to do these Zoom meetings. It's working out quite well. We've been very fortunate that we've been able to continue our research throughout this whole pandemic. So with that, I will stop sharing, and I would be happy to answer questions or comments or ideas for collaboration, anything that people would like to share.
Yes, well, thank you so much, Dr. Rogers. That was a really great talk, and we particularly appreciate your composure during our Zoom bomb. I think that may have been the first time that's ever happened for us.
That was interesting.
It's the history here at Regan Street. So thank you for that. But yeah, I think we would open it up to questions. Either people can turn on their cameras and their audio. If you were a legit participant, which Jasmine is monitoring very tightly right now, please speak up and give us your question, or you can put it in the chat. I'm sure I know I have one. I'm sure Rich for sure has some questions. Anybody want to start us off?
I opened up my chat window so I can see if anybody wants to put anything there.
So, I have one, and it's a little bit, I think maybe kind of taking a few steps back from like the amazing technology per se. And, I oftentimes think about this idea of kind of passive technology versus active. This idea that, we're designing an environment for somebody where maybe they don't need to be, technology literate or even comfortable. But like you said, it's sort of the willingness to at least try it, I guess, versus an active, like providing instruction, like you said, that people oftentimes require. What's your sense on where the kind of innovation is sort of happening to really be able to kind of enhance people's quality of life or activities, or even just maybe even things that we didn't even quite realize were deficits, but that we were able to kind of intervene on, whether passively or actively? What's your sense on either those two types of interventions and technology?
That's a great point. I mean, mostly what I focused on today is more active, where the person is using the technology, and there's a whole area of research focused on more ambient technology, passive, that's collecting data in home environments that might be tracking activities or using sensors to determine, has there been a fall? Is this a typical day for the person? And I think that's a really important area. What the challenge right there is, there's so much information. So you can have all these sensors and you can get a lot of data, but then how do you turn that data into actionable information for care providers? And so data scientists are looking at ways to do that automatically, which is a challenge. The other part, though, that I think is important is the privacy and the ethics component, is, making sure that the person in the home really understands what's being done. And at Indiana University, there was some folks looking at the Ethos project, where they were looking at that, where they had a way to convey to the person living there what's on right now, what's being tracked for me, and so I think that's also an important issue. When you move away from the active to the passive, that might increase some of the privacy and ethical issues that you need to attend to, so people really understand what's happening. A good question.
I have a question. Hi, Wendy. I'm Dan
Hi.
Clark. Thanks for sharing all of that. It's impressive. The volume of work is impressive, but your innovation is obviously very impressive too. Thanks for sharing. I was particularly interested in the video. I don't recall what you called it, but the video chat tool that you're working with, because we've done some stuff with just Zoom and WebEx, delivering exercise classes, and we're now doing cooking classes. We've done monitoring of cognitive training games through video conference as well. One thing that's always been a concern is engagement. And I wonder, I didn't quite pick up all the details of what your tool has that's different from, say, Zoom. But I would just wonder if you have thoughts about engagement and whether social emotions are, I can't imagine they're the same as in person, but can you get to where the transfer of those emotions and the feeling gets close?
Yeah, I think it's a great question. I'd like to learn more about some of what you've been doing. One of my colleagues at Georgia Tech has a tele-Tai Chi project, where she's actually using, I'll come back to ours in a moment, she's using Zoom to simulate a group activity, Tai Chi class, where there's social part before they do the Tai Chi, and then there's a social part after, to try to capture that experience that you get from going to the gym. So I think I'll share her project with you as well. We've been focusing on it's called oneclick.chat, and it's a lot less than Zoom. So if I look at this is a busy screen. I have lots of different options. It's a much more simplified version. So you can use it for regular meetings, but what's unique about it is I can host an event. And so I might show you, some of the events we're developing right now are really reminiscence based. So it's showing a series of pictures about life on the farm, or momentous occasions in life. And so it's a series of pictures. We enjoy those development sessions because they're fun to look at. So it's a series of pictures. And then we would divide you into breakout groups with a set of discussion prompts for conversation. And we'll be measuring exactly what you're talking about. I think we don't know what makes it engaging. What did you enjoy that? So enjoyment is something we'll be measuring. Did you find it engaging? And did you feel a part of a community? Did you have some sense of cognitive engagement as well? So I think those are open questions that we want to measure. And I would really like to hear more about what you're doing, because we might get some insights from that and what you're measuring in your studies. Thank you for the question. Wendy R at illinois.edu. So send me anything or more questions.
It looks like we do have a question in the chat from Rebecca.
That's a good question. So I'm not sure if everybody can see it, so I will read it out. So what specific research has been generated at the request of geriatric advisors, which should be more consumer driven? One thing that comes to mind is awareness of services that are already available. There's a lot out there that might be useful to older adults. So area agencies on aging, the Illinois Department on Aging, every state has a lot of resources for older adults. And a big part of what they do is answering the phone, where people are calling with questions. How do I find this? Or can I do this? And I think that's a great opportunity for technology to help people. They don't even always know what questions to ask. And so we're trying to develop using things like Amazon Alexa or digital home assistants, where you can have more of a conversation. What is it you're looking for? Is this what you need? You know, a back and forth that's a more naturalistic kind of conversation to help people find access to services. I think that's a key care area that's relatively understudied. That's another area that I didn't talk about, which is our work with digital home assistants, which I think have also a lot of potential, much more difficult to use than you might imagine. So another question is how to address older adults' distrust of technologies and fears of messing it up or being scammed. Very good, both of those questions. So one, and that's my mantra of training and instructions, because that is a common concern that individuals have, not just older adults, but older adults in particular. I'm going to mess it up, right? And then I won't be able to get back where I wanted to. And so for the Amazon Alexa projects, for example, we have developed a user guide that's written that they can flip through and look at, and it has step-by-step instructions. We've also developed videos, very short videos. We have a YouTube channel that shows them how to do different things. So that helps address the use part. And the distrust and the fear about scamming are really important. For Amazon Alexa, we explain how it works, and that helps to alleviate some of their concerns that it's always listening to me or my data are being stored, you know, some concerns that people have. The issue of being scammed, I think, is also underdeveloped, and we need to focus more on that. How do we educate people to know? I just did over the weekend cybersecurity training that the university provides. It was very helpful, and it had little scenarios about what to do and what not to do. And I think we could take that and tailor it to scenarios that older adults might encounter. And I think that's an opportunity that we're not tapping into yet.